improving your abilities. As a nurse taking your NMC OSCE with at least the knowledge of a UK-based newly qualified nurse, you should achieve safe meds management. When you get the MAR, the first page will have on its instructions that you will get 5 minutes to read. It will instruct you to talk to the patient or mannequin, verbalize everything to the examiner, read the chart out loud, complete all drug checks, complete documentation, code correctly, check and complete last page. 15 minutes to complete everything. Administer and document meds safely in accordance with the NMC standards. When the 15 minutes begin, you will read the front and inside of the chart before you give out the meds. Provide correct information to the patient. Although the patient will not be nil by mouth and can and will take the meds, they do still require correct information about their medication. Showing good communication with the patient is essential through simple, effective explanations of the correct medicines due, even though it is only a mannequin and not a real-life actor. Explaining all your actions without over-explaining things is the key, as it wastes valuable time. By reading the medication chart out aloud, the examiner can assess your awareness of the medication safety checks. Ship ALPs prior to medication administration. Use SHIP ALPs safely and as a patient-centered approach to introducing yourself during implementation. S. Safe to approach. H. Hand hygiene. I. Introduce yourself and your role as a nurse. P. Preferred name they like to be called by. I. Identify. A. Allergy. L. Latex. P. Pain. S. Score pain. Meeting the patient. SHIP ALPs approach. Approaching the patient, you must use the same process as in assessment and ensure the area is safe to approach, checking for cables, obstacles, and spillages. Infection control should be observed, so 7 steps of hand decontamination must be performed before approaching the patient. Introduce yourself as the nurse looking after Sumira during your introduction. Next, check for their preferred name before asking for their full name and date of birth. Check on their ID band and also in their paperwork mentioning their hospital number. Identify any allergies and ask what reaction they have experienced after taking the drug. Mention latex separately. Also, verbalize that the patient is not currently nil by mouth, NBM, and also ask them if they have any difficulty swallowing. They will always be able to swallow normally and never be NBM for obvious reasons. Explain the purpose of your visit: to administer her medications, therefore obtaining consent. Assess for pain, nausea, and comfort at this time. Pain level should be scored out of 10, with 0 being no pain at all and 10 being the worst imaginable. Ask whereabouts in their body the pain is. Do they need analgesia at this time? Read out the pain relief they have already been given and ask if they have had any other pain medication. Be careful that PRN pain relief hasn't been administered from elsewhere on the chart, on the regular or stats part of the chart. Check that their weight is not under 50 kilograms, as they will not be able to have a full 1 gram of paracetamol if they are below this weight. Common errors. Candidate performance. Candidates who were unsuccessful in this station commonly displayed the following trends in performance. Administered wrong medicine. Candidates administered medication which should not have been given at that time. Did not accurately document the medication details. Candidates did not accurately document administration, non-administration of medication. Did not demonstrate appropriate knowledge of medication. Candidates did not demonstrate appropriate knowledge of medication. Not using systematic approach when verbalizing drugs. Candidates did not use a systematic approach when checking and verbalizing all drugs recorded on the medication administration record. Did not follow appropriate checks before administering the medicine. Candidates did not follow all appropriate checks required before administering the medicine. Did not verbalize the checking of the validity of the prescription. Candidates did not verbalize the checking of the validity of the prescription, including the prescriber's signature, dose, route, and time. Recorded and signed the medication administration record before the person took the medications. Candidates recorded and signed the medication administration record before the person took the medications. Candidates administered the incorrect dose of medication. Candidates ran out of time and did not complete the medication administration record. Candidates did not check the person's identification, name, date of birth, and hospital number. Candidates did not administer any medication during their time in this station. Common errors seen on the charts are: already had a dose from stat dose and it's written elsewhere on the chart. Allergic to the medication prescribed. You should have checked allergies earlier. Dose is wrong, either too high or too low. Wrong units written next to the dose. Prescription is incomplete and not signed. Start date incorrect and is not to be started today. Not due at this time. Be careful about times. Current OBS conflict with the medicine being given, such as beta blockers in relation to BP. Current condition means drug is now contraindicated. Failure to check the expiry date of drug and say it out loud. The professional duty of candor. Every healthcare profession must be open and honest with patients. When something that goes wrong with their treatment or care causes or has the potential to cause harm and distress. This means that the healthcare professional must tell the patient, or when appropriate, the patient's advocate, carer, or family when something has gone wrong. Apologize to the patient, or when appropriate, the patient's advocate, carer, or family. Offer an appropriate remedy to support to put matters right, if possible. Explain fully to the patient, or where appropriate, the patient's advocate, carer, or family, the short and long-term effects of what has happened. Note: healthcare professionals must also be open and honest with their colleagues, employers, and relevant organizations, and take part in reviews and investigations when requested. They must also be open and honest with their regulators, raising concerns where appropriate. They must support and encourage each other to be open and honest and not stop someone from raising concerns. Seven rights of medicine administration. Number 1. Right patient. Requires a full ID check, including name, date of birth, and hospital number or address if in the community. Number 2. Right medication. Relates to compatibility with the patient's condition, the action of the drug, and the labeling of the bottle. Also, allergy status. Number 3. Right dose. Known through nurse's prior knowledge of the drug or by checking it in the British National Formulary. The patient's weight should be noted, as it can be relevant in some drug doses. Number 4. Right route should be checked, as you will always be administering oral medication in the OSCE implementation station. Number 5. Right time. Include right date when the drug commences, also the correct frequency prescribed, as well as finding the time on the chart. Number 6. Right documentation. The nurse must sign or code correctly for meds given or withheld. Number 7. Each drug should be signed by a doctor. The bleep number is normally written next to their signature, but you can still give meds without it. It's not a legal requirement. Medication checks. If you are using the correct checking processes, you will not miss any of the errors on the chart. The medicine label should be carefully checked for validity and against the drug chart. Apply the 7 rights of medication administration to the MAR chart for safe administration and to ensure any errors are recognized. There will always be mistakes on the chart, for sure. There may also be medications that are not wrongly prescribed but are written in a way that could lead to an error being made. A good knowledge of medications is required to understand the medicines charted, their actions, side effects, and contraindications. You must offer a full explanation of all medications, their therapeutic effects, and their side effects. Medication Administration Records, MARs, also called cardexes, contain errors in real practice, and this is reflected in this station. A nurse administering medication should be able to identify the prescription errors. If you do identify errors, you are bound by the NMC duty of Candor to advise the doctor, the patient, and the relatives where necessary. Things to keep in mind. Explanations to patients must be open and honest, being clear about their treatment and any mistakes made in their care. Nurses should know when and how to escalate medication problems to the doctor. Escalations are usually related to a prescription error or the need for medicines to be prescribed for current symptoms. Careful time management is required to complete all of this in 15 minutes. Reading out the drug chart can slow people down, and so it must be practiced in a timely manner. Allow time to check any unfamiliar drug dose, the indication and side effects in the BNF. Interactions between drugs can occur in the OSCE. Any doubts, check the BNF. If you are unsure, withhold and escalate to the doctor.